health alert for you tonight. If you've ever suffered from a migraine headache, well, you know it can be crippling.
Yeah, for some, that hammering pain is relentless every day for hours on end. However, a new high-tech treatment promises to turn off that severe migraine without drugs, giving so many people their lives back.
Local 2's Rachel McNeil explains how all of this works.
I've had headaches every day for 5 years.
When 18-year-old Morgan Barton talks about her headaches, they're not just inconvenient, they're life-altering.
My eyes hurt so bad, and it just feels like someone's just trying to push my eyeballs out. I've had a few headaches where I've had to go to the emergency room.
Morgan tried everything: neurologists, cardiologists, sleep studies, chiropractors, spinal taps, Botox. Her sophomore year, she missed 5 months of school, relegated to a dark room, trying to sleep off the pain.
I couldn't function. It was just impossible. It was like a breaking point.
About 10% of migraine sufferers have chronic, debilitating headaches. Many are women in their 20s and 30s. They can't work, they can't sleep. Even medication doesn't work anymore.
We have had some young patients who have really considered ending their lives because they've been so debilitated by these headaches. Just take a peek at your incisions here.
Morgan was referred to Dr. Jack Chapman with Ascendant Neuro, who suggested an implantable neurostimulator that promised to turn off her pain.
I was like, let's go. I was so excited.
Here's how it works. 4 catheter leads are implanted in the head, 2 in the front, 2 in the back. They're connected to a battery placed about 1.5 inches under the fleshy part of the hip. A remote control sets the level of neurostimulation, using electricity to stop a migraine in its tracks.
By stimulating these 4 nerves, we're finding the effectiveness is almost 100%.
The good news is patients can try it out without surgery to see if it works.
After the 5 days off, I did not want to give it back.
Morgan went ahead with the 2-hour surgery and says she came out a different person.
It's definitely like night and day. It's like if someone came on and turned off my light switch to headaches or turned it on to having a normal life.
Devoted to raising animals for FFA, Morgan plans to fulfill her dream and head to Texas Women's University in Denton, where she'll study nursing, something she never thought possible before.
I'm going to get to go away and get to, have my own life and know that I'm not going to be crippled by these headaches anymore.
I'm just so proud of her that she's been able to take this and restore her life.
Dr. Chapman says about 75% of insurers are covering the procedure if deemed medically necessary. Formal FDA approval is expected in the next year or 2. In the Woodlands, Rachel McNeil, KPRC, Local 2.
Wow, good for Morgan. Life-altering, isn't it? If you'd like to find